it's a real pleasure to have you here today, and we are waiting forward to see your keynote speech, and you should be able now to share your screen and presentation. Good luck.
Thank you so much, and thank you so much for inviting me to join you today. Can you see my screen now?
Yes, we just
Fabulous.
need to, yes, it's in presenting. Thank you.
So thank you so much for that kind introduction, and it's a real pleasure and honour to be with you today. I have been asked to talk to you about my journey from clinician to entrepreneur, and I'll explain what learning to ride the lion means during my presentation. But obviously, having started my career as a clinician, and I now sit here as Chief Exec at Orca, the obvious question is, well, how did you get from A to B? And so I just wanted to start really by telling you about my journey and how I found myself running a digital health company. And then what I wanted to do was talk you through some of my lessons that I've learned, and I'm sure that this will resonate with quite a few of you. So just to take a step back, like many of us, when we're about 15 or 16, we get asked a question at school, which is, what do you want to do for your job? And it's a tricky question because we're 15 or 16 and we don't often know. And I didn't know what I wanted to do for a job, but I knew what was underneath any job that I wanted to do in the future. And that was my passion. And my passion was I wanted to help people. And that is my real strong value. Now, naturally, that took me to thinking about health and healthcare roles. But I also knew that I didn't want to be a doctor or a nurse because I'm quite squeamish. So I started to look at other careers in healthcare and found speech and language therapy. And seeing as my school reports always said, talks too much in class, I thought this is a good option for me. So I hung my hat on that and went off to university and did my degree. And I was so excited on day one when I went into clinic, because I thought, today I'm going to start to help people. And I spent the day in clinic. And at the end of the day, I felt really frustrated. And that frustration was because I'd only seen 6 patients. And it hit me very hard that as a clinician, you can only see 1 patient at a time. And as with most clinics and healthcare providers, the waiting list was massive. And there were lots and lots of people who needed access to me and my now expert knowledge. And so that started me on a journey of and the question I was asking was, how do we help more people? Now, this was about 25 years ago. So the smartphone was not around, and actually we didn't even have computers on our desks. So I got interested at the time in lean methodologies and pathway redesign, stripping out waste, and with the aim of releasing more time to care. And it was great, you know, managed to start seeing 10, 11 patients a day. I did that across the whole service. And we saw a massive reduction in waiting lists from about 20 months to about 11 weeks within a 3-month period. It was transformational. And I carried on doing that actually across health and care services in England. And if you fast forwarded around about 10 years, started to see the rise of technology. And we now had computers on our desk, electronic health records, and the smartphone had just emerged. And I thought, this is really interesting because technology gives us another route to reduce admin time and therefore release more time to care. But when I started to see digital health and health apps come into the marketplace, and everybody starts to buy smartphone devices, I thought, this is it. This is the answer we've been waiting for, because you can deploy a digital health technology to millions of people all at the same time, and everybody's bought a smartphone. So I thought, this is it. This is the answer. This is how we can help people at scale and pace. But of course, it's not that simple. Now, by this point, I was working nationally here in the UK, but I was also working internationally across Europe and North America. And I thought other countries will have this sorted. They'll know how to distribute technology to people to help health outcomes. And they didn't. It was exactly the same. And although we started to see more and more digital health technologies, more and more smartphones, what we weren't doing was putting the two things together so that we could see the health outcomes really be achieved. And I got really obsessed with that as a problem and thought, well, how do we connect technology to people so that everybody can get the benefit? So what that did was that made me start to think about, well, why hasn't it happened? And there were 4 big reasons. The first was people weren't even aware that these technologies existed. Healthcare professionals are not trained in digital health. The second reason was once people knew that there were hundreds of thousands of technologies, people didn't know how to access them. So where do you go and find these technologies? So I'd urge you to try this. If you go to the Apple App Store or Google Play, what you'll see is that there are, if you type in a word like dementia, you'll get a couple of results found, but you won't get the thousands of technologies that are actually available in that space. And so accessing at the most fundamental level is a problem. The next challenge was trust. People didn't know which technologies to trust or didn't know whether they should trust these technologies at all. The fourth challenge was governance and reimbursement. So if I, as your healthcare professional, have found a technology that I feel I can trust and I recommend it to you, what happens if that technology changes and becomes unsafe in the future? How do I govern that? And who's going to pay for it? So those are the barriers. And I started thinking, well, how do we do this in other parts of health? How do we distribute interventions? And I started to look at the way in which we distribute drugs to people. And the way in which we distribute drugs is we have a very clear licensing process, there's training, there are national formularies and a prescription infrastructure. And that was what I wanted to set up for digital health. And that's what Orca do. So Orca evaluates and assess technologies. We then create distribution channels which start with education and training, and we create digital health formularies. And then attached to those formularies is the ability to prescribe or recommend a technology to a patient. But importantly, the review part of the work is continuous. It re-reviews technology every time the app updates. And so we have a governed system, because if we find a future fault, we can do a recall, but we can also track for reimbursement. Now, we've been doing this work for just coming up to 7 years, and we've made some massive progress. So we're actually now leading in 12 countries. And some of this data is actually out of date. We've now assessed over 22,000 technologies, and we have over 8,000 health and care professionals using the platform. And it's been a real journey of learning. And the reason this presentation is called Learning to Ride the Lion is because people now look at me as the original founder of Orca and as the chief exec and say, wow, look at her, she's riding a lion. And if truth be told, I think, oh my gosh, how did I get on this lion? And how do I continue to ride it? So what I wanted to share with you was some of my lessons learned on my journey, and I've got lots more lessons to come. Every day I'm learning, but these are some of the critical lessons that I've learned on my journey. So the first one is, where do you start? So when you have, some people might want to create a technology or create a new innovation or start a company. Where do you start? Well, you start with the problem. You have to really, really understand the problem from everybody's perspective. And so for me, when I was thinking about the problem, I defined the problem as how do we improve lives through digital health? That was the question. And then I asked everybody who was involved in this space, be it from end users, patients, doctors, nurses, healthcare system leaders, managers, people who are payers, people who are providers, policymakers, thought leaders. Ask everybody about how they experience the problem and spend a long time thinking about the problem, because it's the problem that will get you up in the morning. It's solving the problem that will keep you committed and keep you energized. And also your solution will keep changing, because the problem will stay the same, but the way in which people interact with the solution will change over time. And so that solution has to be adaptable and create based on the way in which people are experiencing that problem. So that has been one of my key lessons, and it's the thing that we still do at Orca all the time. What is the problem we're trying to solve, and how are people experiencing that problem from their perspective? The second lesson has been these three things. So of course you need to have a big dream, and that big dream for me is I want to improve lives through digital health to achieve sustainable healthcare for everybody. That's a big dream. And I want every digital health technology choice to be made with Orca globally. But in order to achieve that dream, having the dream and the vision is absolutely not enough. You then need to set very clear goals. And then the third thing is you need to take action. And I think that was one of the things that I experienced on my journey is, the dream is massive, the vision is massive, but you just need to know what the next step is towards that mission and take it, actually do something. And what you'll notice is that you start to progress further and further closer to your vision. The next thing, the next lesson is about collaboration. So I've shared with you my background. You can hear that my background wasn't in business. My background wasn't commercial, and my background wasn't legal. There was lots of things that my background wasn't. But what I knew was what I didn't know. And so what I needed to do at the beginning, and what we continue to do at Orca, is look at where we've got gaps in a team from either a knowledge or a skill perspective. And so my co-founder has got a completely different set of skills and comes at this from a different perspective. But of course, you've got to value those differences. You've got to appreciate that other people will see things from a different perspective, and you need to be open to listening and valuing those differences. Now, that collaboration extends further and wider. So for Orca, we solve a part of the big challenges around digital health distribution. And so we also collaborate with other people. So we have lots of partner organisations. We partner with other people who do something very complementary to us, but together we can be stronger. And so I think that collaboration is absolutely critical, but what that starts with is really understanding what you're good at and what you're not good at, and being okay with that. So for example, you can hear from my background that I'm not a coder. I couldn't build technology. And sometimes I'll talk to other clinicians who'll say, do you think I need to do a degree in coding? And I say, no, you know about your clinical area. What you need to find is somebody who's amazing at coding who you can then partner with. So collaboration is absolutely critical. The next lesson is something that isn't new, that you will have heard lots of people say, but it's around culture. And having a strong culture as an organisation is so important, because it's that will carry you through some challenging times, and you will have challenging times. And I think that one of the big lessons learned that I've had is you have to really define what the culture is. And that isn't about you as the chief exec or the founder defining the culture. It's about you as an organisation defining the culture, and also the behaviours that flow from that. And a big part of the culture is not that one person owns it, everybody owns culture. And so here at Orca, we talk about this all the time, and we'll talk about behaviours that are either positively reinforcing our culture or not. And our culture is very much founded on some of these lessons learned. So one of them is around collaboration, another is around being curious and seeing if you can do things differently. Another is about having fun, and that's about being passionate and mission driven. So they're all about how the lessons learned, but it's also about feeding the culture and making sure that everybody is living the values and the culture that you want to see. Now, what we also do now is we recruit to those values and culture, because of course that culture doesn't fit everybody. So you need to be explicit and clear about what your culture is. And so that when you recruit, you bring in people who are going to fit and align to that. So this picture is basically to say that success isn't about never falling over. Success is about always getting back up. And so this is really a life lesson, really. You know, we all face challenging times, and it's about how you deal with those challenging times and get back up and continue on that makes the difference. And so from Orca's perspective, when something doesn't quite go according to plan, how do we stand up again and progress forward and learn to not fall in that way in the future? And so for me, it's a real, again, a paradigm or an approach to learning, which is really important. My next lesson is be true to who you are as an individual. Be really clear about what your personal values are. So I know what my personal values are and I'm absolutely committed to them. But I'm also confident that those values are now the values of the company. So transparency, openness, and collaboration. And that shines through in everything that we do. So I'd like to think, and I do know because we do lots of surveys with partners and customers, is that how they experience Orca when they work with us? And I hope that the answer is yes. But it's very important to be true to who you are and true to your values. Again, what that starts with is understanding what those values are and how you want those to be expressed in behaviours. This next lesson is really a way of thinking about resilience. So, of course, on your journey, there are really good times and there are challenging times, as I've already mentioned. And the way in which I deal with some of the challenging times is to think about the journey as a waterfall, as a river with waterfalls. So this picture is actually not too far away from where I live. There's a stream, and every so often there's a waterfall. And some of those waterfalls are big, some of them are small, some of them are very turbulent, others are quite gentle, but there are waterfalls. And that's what it can be like being an entrepreneur. You have calm times and then you have a turbulent time, which is the waterfall. But the critical thing of being in that waterfall and in the turbulence is you must know that it won't last forever. You will come out of it and the water will be calm again. But what's really interesting is just after the waterfall, the water's deeper than it had been previously. And that's about learning. And this is really a way of dealing with some of the challenging times to help you be able to ride the lion in a more positive way. And that's my final lesson, really, which is about being grateful. I am truly grateful for this journey. I have learned so much. And as I said at the beginning, I've got so much more to learn, so much more to do. But every day I'm really thankful and grateful for the journey, for the challenging times and the good times. And I'm grateful that I've got this opportunity to ride a lion. So thank you. I'm happy to take any questions if there are any. Or of course, people can reach out to us. Our email's there, telephone, or through social media. Thank you very much for listening.
Thank you. This was really inspiring presentation and really valuable lessons shared. Thanks once again. We have one question from the audience that says, it's from a physician. How do you work around your own fears for moving forward with your own agenda as an entrepreneur?
So how do I, sorry.
How do you work around your own fears for moving forward with your own agenda as an entrepreneur?
So I think that this is where one of those first lessons I mentioned really comes in. So really understand what the problem is that you're trying to solve. And of course, I am now an entrepreneur, but my core value, the truth of who I am, my passion is I want to help people. And that is what gets me up every day. That's what I value and that's what I stick to. So I think that as an entrepreneur, being really wedded to your values and your mission and what it is that drives you is absolutely critical. And for me, that's helping people. And if we have discussions from a strategy point of view, a talker about where we're going to go next, I always take us back to that. Will this action or decision help more people? And if the answer is no, then we need to question it.
Great. This sounds like a nice trigger to do the things right way. And another one probably is Pat from one of our previous presentations, but it's a good one. If you could give advice to your younger version of yourself, what would it be?
I think that the younger version of myself was trying to be somebody that I thought I should be rather than be myself. And so that's why one of my lessons is be true to yourself, because I think I had a picture of what I should look like and act like. And I don't think that's the truth at all. I think that you just need to appreciate who you are and be that person. So I wish I'd done that sooner. It probably took me about 10 years ago when I was about 35 to feel that I could feel comfortable with who I was and just be that person.
This was a nice message, and I would leave it here. And I think it's a nice conclusion and to all you do and all you are.
No, thank you
Be
so much.
yourself. Yes. Thank you. It was a pleasure having you here today. Greetings from Sofia, and I hope we will have the opportunity to meet you in person.
Thank you so much.